Welcome to the AT Osteo Chronicles. I'm Brynn.
And I'm Jenna Howe. Today we're addressing an important topic that comes up frequently in our practice, and it's to do with chiropractic care and concussions.
Today we have the lovely Dr. Amy Petz, who specializes in concussion recovery and whiplash.
Dr. Petz, thank you so much for joining us today. Could you share a bit about your background and your experience with concussion management?
Thank you for having me. I've been practicing chiropractic for 2 years now, and I've taken additional certifications in concussion management, vestibular rehab therapy, as well as diagnosing musculoskeletal injuries. So I've been working with athletes ranging from high school to professional levels, and I'm particularly interested in the cervical spine's role in post-concussion syndrome.
Can you explain a little bit more about the cervical spine and how chiropractics could help with concussion symptoms?
So that's a great place to start. So many people don't realize that the cervical spine and the brain are closely related. So when you have these impact type concussions that are mainly seen within sports, you have that fast acceleration and deceleration. So with this, that causes stretching of the brain tissue, which causes those chemical releases, which causes the concussion symptoms. And then you also have the effect on the neck. So you're having that fast stretching forward, which is stretching the joint capsule between the vertebra and the neck, and it's also affecting the muscles, so it's causing those sprains and strains within it. So this causes a lot of inflammation and irritation within the joints of the neck, as well as causes some tightening of the muscles, because the muscles' role is to stabilize the spine. So if your joints aren't functioning properly, it's causing this increase in tightening of the muscles in the area, which can also cause the same symptoms as a head or as a concussion. So that leads to the headaches, the dizziness, not being able to tell where you are in space and time. It also can relate to different like eye and movement disorders, and different like vestibular problems. So they're both intimately connected.
Yeah, and that makes sense from an osteopathic perspective as well. We often see as osteopathic manual practitioners, we often see how the dysfunction in one area can manifest symptoms in another area. And I know with osteopathy, well, it depends on the practitioner, but I tend to, when it comes to whiplash, I tend to work more sort of dural tube relationship, like more of a neural peripheral nerve perspective, and muscle. So it ties really nicely. It sounds like within how you approach it from a chiropractic perspective.
Yeah, exactly. And with so many symptoms being related, or there's so many different causes of concussion or different things being affected with concussion, it's good to have different practitioners that address each of these levels. So ones that address the dural tube, one that address the joints, the muscles, as well as looking into the chemical aspects of it too within the brain.
And I mean, maybe I'm jumping a little bit too far ahead, but we can see. So if you think we can address this either now or a little bit later. But the was it CCI, the cervical spine instability?
Mhm.
Do you work a lot with that? Because I know there's it's like a more of a specialty. I sometimes I just know a little bit enough to go, this is not a thing that I deal with, and
Mhm.
then I refer out. So are they is it in the same camp of what you've just talked about, or is that something completely different that maybe we can touch on a little bit later?
It is in a similar camp. So I've been trained in different ways to kind of recognize and how to deal with that, but we can touch on it a little bit later as we go.
Awesome.
So, what I have heard a lot of people say or be wary about chiropractics is how aggressive adjustments can be, but chiros can do more than just adjustments. And how do you approach a concussion?
So my approach begins with a comprehensive assessment. So a lot of people are afraid of the adjustments. So usually that's something that I introduce a little bit later into care. So with this, initially we evaluate the cognitive function, balance, visual tracking, cervical range of motion, and joint function. And then from there, we're able to develop a better clinical picture of what's happening in the body and kind of tailor our treatment towards that. So usually with treatment, initially we'll start with kind of calming the muscles down because everything's so tight and grabbing. What we want to do is get the muscles to calm down and do some light mobilizations before we get into anything too aggressive.
That sounds fantastic, actually. And that interdisciplinary approach really resonates with what we do both in athletic training and with osteopathic practice. And it's really important, I think, for patients to know that there are certain professions that will really honor where they're at with their symptomology. So I've had patients who their chiropractic journey was amazing. And then I'll have other people where they just their particular practitioner at that time just does regular adjustments and they don't do anything different. And it's not very well matched with the person that they're working with.
Yeah, and I think that's something important to look at too. Like if you're just getting the adjustments, that's just one tool. In order to become symptom free, you need to do multiple things. So that's going to be chiropractic, soft tissue, exercises. So if you're only getting one thing from your chiropractor, which is the adjustments, then you're not getting the full clinical treatment or proper treatment that you need. So it's good to work with other practitioners as well. So you're hitting everything at once rather than just focusing on one thing. Because if you're focusing on one thing and you're not adding in the other parts, you're going to be missing things at that same time.
Yeah, I love that approach because, like you said, there's so many aspects to a concussion and different things, and we're not all trained in all those areas.
Yeah, like really creating a comprehensive care team. I know I've talked with Brynn about this before, but coming from Ontario to British Columbia, just as a practitioner in general, Ontario at the time, it's probably different now, but at the time, people had one or two practitioners and then that was it. Like they didn't really have what I would look at as like a whole care team. And then moving out to British Columbia and starting my practice out here, it was really interesting because it's like everybody has several therapists in their back pocket that they see at any particular time. And I had to figure out how I fit myself into that model. And when I moved to Victoria, other than I think one chiro that worked with the rugby team that my son was involved with, and the neuro optimization, there wasn't anybody else that was even addressing concussion symptoms at the time. And so I've had to learn over the years how to fit myself in, what to look for in other therapists, how to create that really integrative approach and figure out how the patient benefits from everything rather than being siloed in all these different camps. And it's, who I am as a practitioner. So it's really nice to know that there are also other therapists who really appreciate that integrative model.
Yeah. I did want to touch on the cervical instability a bit more, if that's okay with you,
Mhm.
Dr. Amy. There's also the concern with that instability of the vertebral arteries that run through those vertebrae.
Mhm.
And people can be wary about getting their neck adjusted. Can you explain what you look for and how you address those safety concerns?
Yes. Okay. So safety is paramount when we're looking at if a manipulation is going to be best suited for that person. There's a few different things that we're looking for. So first thing, we're going to check the red flags. So we're going to ask the right questions. So we're going to ask about, and it's a lot of people will be coming to a chiropractor for kind of the same symptoms that come up with like the vertebral artery deficiencies. So that's going to be like the headache, the neck pain, that kind of thing. So it's important that we ask the right questions. So, and look for the right things. So a lot of that is going to be things like looking at neurological reflexes, looking at pupil dilation, looking at if they're getting faint or dizzy or they're having like drop spells. We're also going to look at differences with like speech, vision, and those kind of things. So we're going to be looking at the bigger picture rather than just like, oh, you have neck pain, this is going to be what's suited for you. With chiropractic adjustments, a lot of people are scared of them because they've heard of things such as like stroke. With that, there's a very low risk of it. Like you're more likely to get struck by lightning twice in your life than you are to have a stroke from a chiropractic adjustment. Basically, we're putting the same force through your neck that you would if you're turning your head. So like people have had vertebral artery dissections because of like shoulder checking. So basically what's happening is within the vertebral artery, there's different layers to the artery, and some of them can become a little bit separated, and then blood can fill those areas, creating this weakness within the artery. So with this, it is something that can be a complication. It is not something that we're worried about for most people. And especially with this, usually there's something that's already in motion or happening. So like if I do it, it's not going to cause a vertebral artery dissection. If it's already in process, something could happen. But again, we're looking for those different changes. We're looking and asking the right questions to make sure that that is something. And if there are any red flags, we're going to send you off for more testing and like imaging before doing anything.
That sounds amazing. I wish you were in Victoria, although I'm moving my practice over to Burnaby.
Oh, perfect.
We'll talk about where your practice is a little bit later. Yeah, so we've talked about the safety concerns. What about timing post-injury? So well, I've got two different questions in my head. One, if it's like a fender bender whiplash versus getting tackled in football kind of whiplash, would you look at those in the same lens? Is one question. And then the other question is, how soon after that injury would you want that person to come into your office to get an evaluation and or treatment?
So with those two, so with the car accident and with like a sports injury, they're both that inertial based, right? So it's both that acceleration and deceleration. So we're looking at, so there's like a few different types of ways that you can get concussions. So like that's going to be more of like a physical kind. And then there's also the pressure. So that can be like rapid pressure changes. So with that, there's not as much neck involvement. So that wouldn't be as high on the list. But with things like the car accident and sports injuries, it is going to be that impact type based concussion. So with that, I want them to come in as soon as they could. Because we want to be able to like get the tissues calmed down and also give them some kind of supplementation in order to help with the concussion. So when you get the brain injury, what happens is a lot of people thought it was more of like an impact base. So they thought it was more like kind of like a brain bruise. But if you get imaging done, like CT scans or MRIs, it's shown that there's nothing wrong with the brain. So it's more of a functional impact. And basically what happens is the nerves in the brain become stretched. And when the nerves have like tiny holes in them, and that's how the different signaling substances get in. So like your sodium and your potassium. So what happens is basically you're getting this stretching of all of the nerves in the brain, which is opening up these tiny channels and kind of flooding the system. So it gets this mass excitatory phase. And then after that, so that's why you get kind of like that initial dizziness, like you're seeing stars, the memory loss, the disorientation, because everything's firing at once and your brain doesn't know how to make sense of it. So then after that, you get that depression phase. And basically that's with that from the massive stretch, there's still high calcium build or like high levels of calcium in the brain, which is kind of limiting the signaling that's going on. So then you get the mass depression. And then that's kind of when you're getting like these feelings of not feeling well, still getting some of the memory lapses, you're getting some of like your headaches and stuff. So with this, we want to supplement so that your brain is able to start getting these nutrients and kind of getting back to that baseline. So a big thing would be like magnesium, magnesium 3 and 8. So that's one of the only magnesium that crosses the blood-brain barrier. And then we'd also want to do different inflammatory things. So you'd want to be using like phosphatidylserine and also omega-3 and omega-6 are like the main ones that I like to put my patients on right away.
Amazing.
Yeah, I would have to agree with you. The the sooner that they get to see someone, the sooner they can be on their recovery journey.
Mhm. Yeah. And just being able to get educated about it sooner, about like what's going on in the body and kind of how to manage it. 'Cause a lot of times people are told to rest, and rest may not be the best option for people.
Yeah, I remember back in maybe 2013, 2014, it was still the primary thing was like, don't do anything, like no exercise, no visual stimulus, like just no nothing.
Mhm.
And
Sit in a dark room.
yeah, and what I noticed with the teenagers that I was working on, excuse me, is the rate of depression was so high. And so there was also this assumption that the depression was related to the injury. But what my observation was is that so much of it is that depression was the inability to be allowed to do anything. They weren't allowed to get up and walk. They weren't allowed to socialize with their friends. And as you've both have worked with teenagers quite a lot, you know how social they are and how they want to be always doing something, especially athletes.
Mhm.
And so it's interesting over time watching how that conversation shifted and they're like, okay, actually now we want more blood flow and like gentle activity and like don't remove yourself from everything. But I still have people coming in mentioning that their primary care physician or whoever is like, yeah, don't do anything at all. Just go to bed and avoid life. So it's still something that happens, but um, it's interesting to see how things have changed over the years too, in terms of what's advisable in those, first few days post concussion.
Thank you, Dr. Amy, for joining us today. I just want to summarize on a few things that we've gone over. Chiropractics can definitely help individuals with concussion, but it's about finding the right chiropractor. And some of the ways that you were speaking and telling us this information really informed me on how or what other individuals should look for when looking for a chiro that is concussion informed. So one of the things that you mentioned was the exercise and the soft tissue. You don't just do adjustments. You go with what the body needs and what the person needs for their treatment. And so people should be looking for that in their chiropractor because like you said, the concussion has so many different aspects, and if somebody only does adjustments, they're not going to get that full rounded care that they really need in their recovery.
Yeah, and I don't think there's probably nothing else that I think we need to add to that summary. It pretty much sums it up. And we're really happy to have you with us today, Dr. Amy. We do know that people like you, chiropractors like you, are really important for patients to know because there is that general fear around them. And we love your approach and your integrative nature, and it just sounds amazing. What is the best way for anybody who's listening to this or any of our patients? What's the best way to find you? Where are you located?
So I'm located in New Westminster, which is a suburb of Vancouver. So I'm at Catalyst Kinetics Group in New West. And if you wanted to find me online, I'm at Dr. Amy Petz DC on Instagram.
Awesome. Thank you.
Thank you.
Thank you for joining us.
So we'll wrap up our discussion for today. We hope that everybody has enjoyed this discussion. We thank you for listening, and we welcome you to come back to the AT and Osteo Chronicles. And remember that healing happens on multiple levels.